Good afternoon and welcome to Valley Views. I'm your host, Glenn Edison. We're certainly glad to have you. And as always, you can see our program on Channel 18 of BTC Fiber's cable channel, as well as BTC Fiber's YouTube channel. And today we have with us Stephanie Boynton, and she's Vice President and CEO of Erlanger Bledsoe. Stephanie, it's good to have you today.
Great to be here, thank you.
And we appreciate you being with us. First of all, let's do a little history, because I know we have a lot of people moving into the area that don't know the background of actually Bledsoe County. How long has the hospital been around?
So this year marks our 50th year of being in existence for the Bledsoe Hospital. And it actually marks our 20th anniversary as being a part of the Erlanger system.
Oh,
so we're
okay.
celebrating two big milestones this year.
Two anniversaries. Well, that's
Yes.
good. That's good. And I guess with the hospital being a little older, I'm assuming there's always ongoing updates and things with the things that you provide here, as well as the surroundings.
Sure. Actually, we do provide a lot here, and when you speak of updates, our biggest update, if you noticed when you drove in, is our new physician office building that we are building on site here. So that's something we work very closely with Bledsoe County, and they are building the site or building the building for us. So that's probably our biggest improvement that we've made, certainly in some time.
Well, that'll help localize some doctors, and it opens up for more programs for them.
Yes, our plan is that our current physicians that are occupying the building next door, those physicians will move into the space, and then it will also open up some additional space that will move some of our specialty physicians that we hope will rotate up from the Erlanger, the main campus, give us more opportunity to bring services here to the Bledsoe community.
Well, that's good. What are some of the services you offer here?
So we are a critical access hospital, and for folks, if you're not familiar with that, a critical access hospital is designated by the government as really a need in a small rural community. So we have the ability to have 25 patients on our floor, and that can be a combination of our inpatients as well as a swing bed patient, which is typically the patient that needs the skilled care, maybe not really sick enough to be in the hospital, but yet not well enough to go home. So we provide that in our swing beds to many patients that, if they just need continued therapy or things along that line, we can keep those here. Of course, we offer a full service emergency department, lab and radiology. We have a link with teleradiology to have our radiology exams read online, as well as through the trauma center. We can converse back and forth with Erlanger. We have a pretty robust therapy program off campus here. If you're familiar with Omni Rehab, we have our therapy offices, our outpatient are there. We offer cardiac and pulmonary rehab on campus. Another thing that we've added recently is our 3D mammography. That is a real huge step up for us. It's a great opportunity for us, and really it's top of the line in mammography equipment in today's world. So we're really excited about that. We offer our primary care. I mentioned the physicians earlier. We have those, as well as we bring up OBGYN that's currently rotating to our campus. So those are just a few of the things that we provide here.
So really, you're pretty much, for this area, you're a full service hospital.
We try to be what we are not able to provide. We hope to be able to get that patient connected with someone off campus. And also, I'm not sure if you're familiar, but we're the emergency department in Sequatchie County, that is a part of the Bledsoe campus. So we operate that, 20 miles south of us. In addition, they have some outpatient services there as well.
Well, that's really nice. I mean, that I'm sure makes the people here feel more at home, because for a long time, if there was any kind of emergency, is either going to Chattanooga or somewhere else to get help.
Right.
And and of course, Life Force comes here as well.
Life Force is a huge part, I think, of healthcare in this whole region. Many times they may land here daily, or sometimes they may land here 2 and 3 times a day. So yeah, it's certainly a great resource for the area.
Right. Well, the doctors and nurses that you have here on staff, are they all from Erlanger, or are they some that you've hired from the area, or how does that work?
So the staff is primarily our employees. All of our nurses are employed by Erlanger Bledsoe. The physicians are also our employees, with the exception of the emergency department, and we contract with Apollo MD to provide those physicians. And that is something that's provided system-wide throughout the Erlanger health system.
Right, and that's done quite frequently among many hospitals.
It is. Through the state of Tennessee, it's very common.
Because, you can't always, doctors work through the week, and then on the weekend they just overload their schedule and time.
Right.
And plus they'd just be tired.
Exactly.
Just be worn out. Well, what am I trying to say here? The local employees, I'm sure you have a lot that are local that work here.
We do. We are a pretty large employer when you look at the county. We provide a lot of positions here, and primarily our employees are local, but we also pull some from the surrounding areas as well, folks that drive here to work.
Right. Well, you can't always have all the doctors and nurses that live right here in the county. You got to have some somewhere.
Very true.
If a patient needs services that go beyond what y'all can do, how does that work?
So I would think if there's something that a patient needs that we can't provide here, typically they will work with Erlanger to get the patient to that specialty, or if that patient desires to go elsewhere outside the system, that's certainly their option, and we'll work to make that happen too. Being a part of the Erlanger health system, we have what we refer to as the EROC, which is our Emergency Regional Operations. And that is a setup at Erlanger that allows them to help transfer folks out. So if you come into our ER and you need to be transferred out for surgery or something that we don't provide here, we're going to work through EROC to get you a bed downtown. They're going to hopefully assign that. And for some reason, again, if it's a patient that they don't have capacity for, we're working to find placement elsewhere.
And for example, I'm a transplant patient myself, so I know Erlanger doesn't do a whole lot of transplants, because that's really a specialized area. So that would be something y'all would, if your doctor said, hey, this person needs to go on to something else that we don't have, that would be something y'all would prefer.
Absolutely, they would work with you to go to whatever provider that would meet your needs.
Well, that's good to know, and knowing that y'all, I know you work closely with Vanderbilt as well.
We do.
And actually, they've come to Chattanooga, haven't they, some to work with the hospital, and so that's a good relationship with Vanderbilt.
Yes.
Because, I know y'all are level 1 trauma center.
They are, yes.
In Chattanooga, so that and the system is spread out North Georgia, all over Middle Tennessee.
Correct.
And so that's it's the name itself. People are feel rested and assured that they're going to get the help they need.
Certainly, Erlanger is definitely a leader in this, not just the region, but the whole state, I think, in many ways.
Yeah, because you can mention Erlanger even when you're not, if you're in another area of the state, and they go, oh yeah,
Very well known.
Very well known.
We always said that we had instant credibility when we became a part of Erlanger because of their reputation. So.
Well, and also talking about, since you are considered a rural hospital, those are going by the wayside, aren't they?
They are, unfortunately. We've seen several close the last few years. Several rural hospitals have not survived.
And a lot of it is finances primarily, but and then of course patients. A lot of rural hospitals can't provide. If they're just a standalone hospital, not like connected with Erlanger, they just can't provide the things that some of the other hospitals can.
Right. Yes, it is certainly to our advantage to be a part of the Erlanger health system. We were able to provide things. If we were a standalone facility, we wouldn't have access to many things that we do through the Erlanger system.
Right, and that like I say, gives you the credibility you need and the help you need, and then you can also rely on other services.
Absolutely. We have the EPIC, which is our electronic medical record. If we were standalone, that's not something that we would have as a small community hospital. We have certainly the buying power is totally different being a part of the Erlanger system as opposed to being a standalone. And then really just having an automatic link to the resources at Erlanger, just a direct line to those physicians. And it's a huge help to this entire community.
Well, me personally, I like the electronic part because I can go on my chart and see where I'm at, what's going on. I can see the doctor's report, after they finish and put that on, and so it helps me.
It is. It's a great asset, and then also that follows you through the system from your physician office visit to your hospital stay to then any follow-up that you may have to do. And so that's the beauty of us being a part of the system is, if we have you at Bledsoe and you're transferred to Chattanooga, they can see everything that was done here. So it's very much
Well, I know when I had a liver transplant at Vanderbilt, and when I read some of my things, I thought, I didn't know I had that. They
learn a lot.
Yeah, they put down everything. But it's informative for the patient, and to have that information, because you can always go back and check it. And then of course you get notes that you can send. If you have a question, you can always send an email, and it'll be answered. It's always answered.
Yes.
And so that's the thing I like about that as well, because sometimes in calling you may have to wait, or they may just have to call you back, and it might be a few days because they're busy.
Right.
But with emails, it's more they check those on a regular basis, and if it's a serious enough question, they'll get back quickly. So that's what I like about that, and that's a good thing that, and that's a fairly new as well too. It's not just a few years old.
It's been around a few years, but yeah, it's still relatively new. And honestly, it's constantly, there's upgrades all the time, and so it's expanding and getting better as we go. So.
Yeah, I hate it when you change, because then I have to learn something else. I've seen some things the other day, and I thought, that's not the way it was. But it's a good thing, and I'm glad you have it. What about in the community, as far as the community events? How are y'all involved in some of the community events?
Well, certainly the last few years have been different for community events. With COVID, has certainly changed our world greatly. So we're involved when we can be, but as you know, there's not been a lot the last few years. But we try to do a couple of things. Like, for example, we did a drive for school supplies. As part of our 50th anniversary, we looked at ways that we could give back to the community. And one of those ways is we actually, employees brought in school supplies just for the area schools. When things are normal, pre-COVID, we were very active in the senior expos. We were, if there's health fairs, we participate in those. We've typically set up at the Fall Festival in the past. So we try to be very active in the community.
So you're there.
We're there. We try to be. Yes.
Well, how has, I know COVID has affected everybody, and I know it has affected people actually coming in and visiting the patients. That was almost cut off, wasn't it?
It was.
And for understandable reasons.
Yes.
And then even the treatment of the patients, that changed a lot as well.
COVID is certainly, it's certainly upset everything, and it did change healthcare greatly, because it was just really unusual to not allow someone to come in and visit. So that's been very hard on, it's hard on the patients and hard on the caregivers as well. But I will have to say Erlanger's constantly reviewing that and trying to make it as patient friendly as possible. So any way we can improve for the patient, we have tried to. So they're constantly reviewing the COVID rates and seeing what we can do to improve our visitation.
And I'm sure that hospitals and healthcare workers are probably just as confused as everybody else with everything. I'm not trying to belittle our government, but you get different one thing one day, and then 2 weeks later something else, and you're not sure how to go. So.
Well, I guess for us too, it's another thing that's convenient to be a part of the main campus, is because we have so many folks that are monitoring all that information for us. We have an entire team, emergency management, that's really worked closely with all of the hospitals and our communities on making sure that we're up to date on everything. So again, I'm grateful to have the backing, that we're not having to battle that alone.
Yeah, because that really is a lot of stuff that you have to review. I mean,
it would be.
Guidelines, the CDC, and just everybody. So that would take, like you said, it takes a whole team.
It takes a team, it really does, and we are very fortunate because, like I said, Erlanger pretty much devoted a team to really help to ensure that we were doing everything as we needed to be.
Well, there's a lot of things out there that you just have to make sure you're doing right.
Yes.
And because you don't want to be blamed for not doing something that you should have done. So,
Absolutely.
So it's been a tough job for everybody.
It has. It is. It's a very difficult time in the world, but certainly in healthcare, I think.
Yeah, and I know things, it was really a high priority to keep everybody safe, and then it dropped down a little bit because the numbers started dropping and then rose. It was back and forth, so it might change from day to day.
It does.
I guess it has for y'all.
It has. It really has. But grateful to be at the point that we're at now. So hopefully we'll continue to see the numbers decline.
Well, I hope so. It looks like from what I've been able to pick up on, Tennessee and a lot of the southern states are actually declining. So
let's hope that continues.
Let's hope so. Let's hope so. Well, that was that question. So with COVID, you have I know at one time, of course, you had the numbers out at the prison that didn't help any as far as the county numbers. And I'm not being critical of that. It's just part of it. But how I guess the treatment, y'all had to be very careful too in treating everybody too, didn't you?
Well, yes, everyone's masked. When you come in the facility, all of our caregivers will be wearing masks, and so they've all taken the proper precautions to ensure they're wearing the proper PPE to protect our staff as well as our patients.
And I imagine that got the cost of the PPEs and stuff got extremely
certainly was increased, yes.
Because that was something that you were going along, and all of a sudden, bam!
Yes, certainly increased. Yes.
And so, and some of the hospitals I've seen that they're wearing the suits and everything, so they take a different approach, I guess.
Right.
But that's.
Yeah, we did not have a COVID unit here, but probably if we'd had a COVID unit as they did downtown, our costs would have been drastically increased even more than they were. So.
Yeah, because you have to, you can't do anything for free.
Oh no.
I mean, that's that's just not possible. And so when you rise costs, you have to raise your costs as well. Well, how long have you actually been in the healthcare service?
So actually, for a long time. I actually started here 25 years ago.
Really?
25 years ago, yeah. I came when it was a part of the Bledsoe Community Medical Center at the time, and came in on the finance side. Came in working as the assistant controller, and then I've worn a lot of hats and worked my way up to being the CFO when Erlanger came on board. We changed the operations because we don't do any of the financial side of things here. The billing was all moved downtown. So I stayed on in a director of operations position briefly, and then moved up into the administrator role, which has now became the CEO.
Oh, well, that's good.
I've worn a lot of hats in those 25 years.
Well, that's good. Because that was something I was interested in how, because you see a lot of people that start really on ground levels and advance, and that's kind of what you've done.
I did. I've worn a lot of hats here, and grateful to be able to work in your home community. So I feel like I'm very fortunate to be able to work here in this position and still be able to call it home.
Well, one of the things I think about local and community facilities and businesses is the face. People recognize the face and the name. So you have that, and people can, when they see you out, they can talk to you just like you're a friend.
Oh, absolutely.
And not just the hospital administrator.
Right. Well, and I always say, I am a Bledsoe girl through and through, and I always say we'll put our staff up against anyone's, and we always do very well on our patient satisfaction scores and anything like that when they're comparing us to other facilities. And I said, I really think the difference in that is that our employees here, we have wonderful staff, but they're taking care of their family or their friends, or if not, it's a personal thing. It's not, you're not just a number when you come to Bledsoe. There's a good chance they're going to know you when you come in. If not, they're going to know you and remember you when you leave. So we're very fortunate to have the staff that we have here.
And you mentioned a while ago about the Bledsoe, the Sequatchie County facility. Now, Is that under y'all as well?
It is. It's a department of the Bledsoe Hospital.
So that's something under you as well?
It is.
Okay, because they have a good little facility.
They do a great job down there as well. They really do.
And
Certainly
they stay very busy.
They do. They stay very busy. Met certainly a community need that was going unmet in so many ways when we opened that ER.
Yeah, because it was closed for a long time.
It was closed for about 4 years till we opened it back up, but yeah, we were expecting our volumes to be pretty low when we opened it up, and we doubled our projection the first
Really?
month. Yeah.
Wow.
So it's done quite well.
I mean, I guess that's a good thing, but a bad thing in a way.
Absolutely, but great that it's there for the community, because certainly they've been very supportive of that facility.
I've been there a few times myself.
Okay.
So.
Well, hopefully you got wonderful care.
Yeah, most of the time.
Yeah.
Other than the fact of being a patient.
Right. Yeah.
Well, that's a good thing. And is there anything we haven't talked about you'd like to share with us?
No, I think one thing I think probably most folks know, but we have the partnership, and I touched on this when we talked about the physician's office building, but I think the partnership with Bledsoe County has been instrumental with the Erlanger and Bledsoe County through the years, because we've been a part of the county, or part of Erlanger, for 20 years. And I think that's a different relationship than anyone else that I'm aware of. Most facilities don't have that, but I just, I give a shout out to the county government, to Mayor Ridley and the commissioners for the support they've given the hospital and for building this physician office building. That's wonderful.
I think you find that more in the rural areas than you do in the inner cities, because in the inner cities you got so much going on with the political side, and I'm not saying it doesn't get political here as well, but I think here it's more they care about their patients, their citizens. They care about the people. I'm not saying they don't care about them in the bigger cities, but.
Well, and I think we saw that same relationship when we went to Sequatchie County. We really kind of just repeated that model there, and we've got great support from both the county and the city government in Sequatchie County, same way. And I think without that relationship, we wouldn't be here today. So I do think, actually I've actually spoken at several conferences on what we've done in Bledsoe and Sequatchie, because it is a little bit different than what you see at other facilities. And I hear kind of what you're saying from other people about they don't get that opportunity in the larger cities, but I think that does make us unique.
Right, because probably in the larger cities, just from my perspective, I think they would, a lot of times they have more things to pull from about other things that are concerning them.
Right. And
healthcare may not be on their top of their list.
Well, it certainly is a priority for us, and since we've been a part of the Erlanger system, we have actually seen Bledsoe's health rankings go to number 11 in the state. So that's a huge plus if you're familiar with that. That's really a huge accomplishment for our county to be ranked 11th in health outcomes out of the 95 counties.
Well, that's great, because because before I can remember long before Erlanger came aboard, that the area was just in the need. And
well, we have a great group of physicians, and I think just our connection with Erlanger, we've been able to bring services really to the whole valley that we otherwise would not have had.
Well, I know you have CAT scan facilities in Sequatchie.
We do.
I'm assuming here.
We do as well.
Do you have MRIs here?
We do not have an MRI, so
that's
that's on our future wish list, but we don't have one currently. Yes.
And but you pretty much have everything else that you would need, the X-rays and everything, the radiology and everything.
We do.
And then your health, not the healthcare, but with the what am I trying to say, with the lab over there, your facilities at the lab.
Oh, the physical therapy.
Physical therapy,
yes,
there we go. That's very much needed.
Absolutely, that was something that I just really applaud Travis Smith for his vision of what he wanted that to be, and we're grateful to be a part of that, because if you haven't been in that, it's just a wonderful facility, and I don't think we could have picked a better location to put our therapy offices in.
No, it's really a good spot, and even the physical therapy there in Dunlap, because it's it's a needed area because you never know when you're going to get a messed up knee
Right.
or something that you need the therapy, and it's much needed.
Right.
Well, is there anything else you'd like to go over with us that you?
I'm not aware of anything. I like to brag on our people all day, so I think we've hit on the highlights.
Well, coming in, I know it was nice coming in, and the people were nice. And
Yes, you won't find a better group of employees than we have here.
No, and they all had smiles on that, and that was a key. I like seeing smiles because I've been in places where everybody was sour mouthed.
Everybody here's like family, so.
Yeah. Well, good. It's good to talk to you today, Stephanie. We appreciate you being here. And remember, folks, you can see us on BTC Fiber's YouTube page as well as BTC Fiber's Channel 18. And like us and subscribe to our YouTube page. We're trying to get those 1,000 members there, and we're pretty close. So go there and like it and subscribe. Hey everybody, this is Glenn Edison from Valley Views. We appreciate you watching our shows, and we would like for you to like, share, and follow us on Facebook, as well as like and subscribe to our YouTube page.
Brought to you by Bledsoe Telephone Cooperative, your full-service telecommunications provider right here in the Sequatchie Valley.